If you haven't gotten vaccinated, do it. Personal choice impacts us all, our hospitals, our countries. I make a special appeal to social media companies and media outlets. Please deal with the misinformation and disinformation that's on your shows. It has to stop. COVID-19 is one of the most formidable enemies America has ever faced. We've got to work together, not against each other. We're America. We can do this. To the military medical teams on the ground, thank you for all and everything you're doing. And I'll stop here so we can get to the briefing started. Thank you for taking the time.
Mr. President, can you have a message for vaccinated Americans who are wondering why they should continue to restrict their activities given that your health officials say most Americans will get COVID at some point?
Folks, we'll talk about that later. Come on. Let's go.
Why should Americans trust your administration to beat COVID when the virus is clearly winning?
On voting rights, do you think the Republicans that don't support voting rights?
The virus is clearly winning, sir. Why should Americans trust you?
Appreciate you. Thank you so much.
Mr. President, do you believe Omicron is the beginning of the end of this pandemic?
Thank you so much, President.
How much longer do you think school kids will have to wear masks, sir?
Thanks, everybody. Appreciate you.
Maybe a press conference soon, Mr. President. We look forward to that.
Me too.
All right, Mr. President, so thank you.
We'll start in 1 minute. All right. Mr. President, we'll start with Administrator Chris Swell, whose team at FEMA, as you know, has been on the front lines of the COVID response. Over to you, Administrator.
And everything else.
A lot going on these days, Mr. President. Thank you, Jeff. Mr. President, as you know, FEMA has been working the COVID mission since day one.
He's using social media to build pressure and seek undue concessions. And America's gun terror remains the most shocking and the most underreported story in the world. One child is shot every hour in the U.S. We begin as
Nearest testing sites for you by Googling COVID test near me. Google COVID test near me. And to help lead our federal testing program, I've tapped Dr. Tom, I hope I pronounced it, Inglesby, correct? Is that right, Jeff? He's one of the world's leading infectious disease experts, and I'm grateful for his willingness to help tackle this challenge.
Will China cancel the 2022 Winter Olympics, better known as the Genocide Games? It should. The Games should have never gone to China in the first place, but the world showed no spine. All it could offer was half-hearted diplomatic boycotts. Now, China's homemade virus may do what superpowers fail to do: derail the Genocide Games. They're scheduled to begin in 3 weeks from now, and the Wuhan virus is unrelenting. The Omicron variant is spreading fast. It has left China's zero-COVID policy in shreds. One more Chinese city has been put under lockdown, the city of Tianjin in the Hebei province, the fourth city to be locked down in 2 weeks. A handful of cases were reported there on Tuesday. For that, all 14 million residents of Tianjin have been locked up in their homes. This is a bit of a panic reaction. Tianjin is located just 134 kilometers from Beijing, China's capital and the host for the 2022 Winter Olympics. Has Omicron reached Beijing too? It's hard to say, but given its transmissibility, it can only be a matter of time. Let me show you some images from Beijing. These are the venues for the Olympic Games, sealed behind giant metal fences. China has created an impenetrable bubble, or so it hopes. It stretches 200 kilometers across Beijing. For the next 3 weeks, everyone associated with the Winter Olympics will have to stay inside this bubble. From hotel staff to volunteers to translators to cleaners, all of them, they've all been locked up inside this bubble. No one is allowed to leave. You see, this has become a matter of prestige for Beijing. In 2008, when they hosted their first Olympic Games, Xi Jinping was in charge. The event cemented his political position, and then he went on to become the president of China. Now, in 2022, he's presiding over another Olympic event, and this one may spell the crash of his geopolitical position. China is seen as global enemy number one. The truth about the origin of the Wuhan virus is still not out. China refuses to give access or share data. There is no telling what goes behind the Great Firewall. So when China locks up more than 30 million people because of a few hundred cases, the world wonders if it's hiding something more sinister. Let me show you another video. China has set up quarantine camps like these for the infected. They look more like concentration camps, some say. Endless rows of metal boxes with suspected Wuhan virus patients inside. Then we have another video. It shows hundreds of buses carrying people to quarantine camps in China. According to some accounts, if there's one Wuhan virus case in an apartment, all residents of the building are packed into buses and sent to quarantine. Those who refuse to go are treated like this, manhandled by health officials and dragged out of their homes if they do not comply. China's crackdown on patients and people is not new. We've seen multiple instances in the last 2 years. But this time, there is more at stake. The reputation of Xi Jinping. The chance to sports wash the genocide in Xinjiang. No wonder China is going to extreme lengths to secure the games. How's the rest of the world faring? Mulling another extreme. They're talking about living with COVID. The cases continue to rise. We'll begin with India. The active case count in India has touched 1.1 million, meaning there are more than 1 million COVID-positive patients in India as we speak. In the last 24 hours, more than 247,000 new cases were reported. That's a 27% jump in one day. What about deaths? 380 in a day. The trajectory does not look good as India readies for elections in 5 states. Prime Minister Modi held a virtual meeting with chief ministers of various states today to discuss ways to contain the surge. In the United States, a new study has established what most experts have been saying. Omicron will cause fewer hospitalizations, it says. This is based on data of 70,000 patients in California. But the findings of the study do not match America's reality. Hospitalization numbers have broken previous records here. This is according to the U.S. Department of Health. More than 140,000 Americans are in hospital. This is the highest since January 2021. It doesn't help that America's top health expert, Dr. Anthony Fauci, says that Omicron is likely to, quote-unquote, infect everybody. He said the risk of severe illness remains low. In neighboring Mexico, there's a sharp surge in cases, at least 40
cases and record hospitalizations. I've been saying that as we remain in this pandemic. This is a pandemic of the unvaccinated. And I mean by this, right now, both vaccinated and unvaccinated people are testing positive. But what happens after that could not be more different. If vaccinated people test positive, they overwhelmingly have either no symptoms at all or they have mild symptoms. And if you're unvaccinated, if they test positive, you are 17 times more likely to get hospitalized. As a result, they're crowding our hospitals, leaving little room for anyone else who might have a heart attack or an injury in an automobile accident or any injury at all. And yes, the unvaccinated are dying from COVID-19. But here's the deal. Because we fully vaccinated nearly 210 million Americans, the majority of the country is safe from severe COVID-19 consequences. That's why even as the number of cases among the vaccinated Americans go up, deaths are down dramatically from last winter. For example, before its vaccination requirements, the United Airlines was averaging 1 employee dying a week from COVID-19. After implementing this requirement, it's led to 99% of its employees being vaccinated. United had 3,600 employees test positive, but 0 hospitalizations. 0 deaths in over 8 weeks. But as long as we have tens of millions of people who will not get vaccinated, we're going to have full hospitals and needless deaths. So the single most important thing to determine your outcome in this pandemic is getting vaccinated. If you're not vaccinated, join the nearly 210 million American people who are vaccinated. If you are vaccinated, join the nearly 80 million Americans who have gotten the booster shot with the strongest protection possible. Vaccines are safe, they're free, and they're widely available. So do it today, please, for your sake, the sake of your kids, the sake of the country. Now, I don't like to, outline the next steps we're taking against, I'd like to outline the next steps we're taking against the Omicron variant. Vaccinations are obviously the most important thing we're doing, but they're not the only important thing. First, masking. Masking is an important tool to control the spread of COVID-19. And when you're indoors in public places, you should wear the mask. And there are a lot, lots of different kinds of masks out there. And the Center for Disease Control and Prevention, the CDC, says that wearing a well-fitting mask of any of them is certainly better than not wearing a mask if it's well-fitting. What if over your nose? But it's about one-third of Americans report they don't wear a mask at all. As I've said in the last 2 years, please wear a mask. If you're in I think it's part of your patriotic duty. It's not that comfortable. It's a pain in the neck. But I've taken every action I can as president to require people to wear masks in federal buildings and on airplanes and trains because they cross state lines. I've made sure that our doctors and nurses and first responders have the masks they need. Never again we're going to have our nurses using homemade masks and garbage bags over their clothing for hospitals because they don't have the gowns. We've more than tripled our stockpile of the most protective specialized N95 masks since coming into office. This is going to make sure that there will be an ample supply of healthcare workers and first responders. We also have helped make sure that high-quality masks are widely available in ample supply at affordable prices, sold online and in stores. But I know that for some Americans, the mask is not always affordable or convenient to get. So, next week we'll announce how we are making high-quality masks available to the American people for free. I know we all wish that we could finally be done with wearing masks. I get it. But they're a really important tool to stop the spread, especially of a highly transmittable Omicron variant. So please wear the mask. Second, testing. Just since Thanksgiving, over 800 military and other federal emergency personnel have been deployed to 24 states, tribes, and territories.